What questions should I ask my surgeon after I've been operated upon? Here's some important thoughts. You've now had your surgery. Your surgery may have been a lumpectomy. It may have been a mastectomy. If you had a mastectomy, it may have involved reconstruction with a tissue expander or some of your own natural tissue from your body. But you're now back after the surgery, awaiting the results, and particularly the pathology results, that the surgeon should have during that initial postoperative visit. You want to be sure that you get a copy of your pathology report, and in particular, you want to make sure that your surgeon goes through that pathology report line by line with you so that you understand it. You want to have an idea at this point, what is the stage of your cancer? You want to know about the size of your tumor. You want to know about the edges or the margins around the tumor, that they're negative, that there isn't cancer at the edges, because if there is, you would need additional surgery to have what we call clean margins. You want to know about your lymph nodes. If only a sentinel lymph node biopsy was done, you want to know if it's positive or negative. You want a lot of details about what went on during your surgery, particularly the pathology report. One of the questions I'm often asked is, gee, Dr. Harness, did you get it all? Well, remember now, surgery is part of what we call local regional control. For invasive cancers, this is only one aspect of your total treatment. Many patients are still under the impression today that after you do the surgery, everything is over. Hopefully, you've seen other videos of Breast Cancer Answers for invasive cancers that tell you that's not the case. Because for invasive cancers, we have to treat the whole body, involving either anti-hormone therapy and or chemotherapy, in order to treat cells that have circulated around the body. The surgery then is part of the local regional control, and if you had a lumpectomy, then you would generally have some follow-up radiation therapy, or perhaps you even had radiation therapy at the time of surgery called intraoperative radiation therapy. So other important questions to be asked of your surgeon is, what's next? First of all, you've got to heal up from the surgery. That generally takes 2, 3, 4 weeks. And then there's often additional adjuvant treatments, such as, again, anti-hormone therapy, potentially chemotherapy, or radiation therapy. Let us not forget, in the recovery process, you may also need to be seen, and we would recommend this, by a physical therapist, and in a physical therapy department that is organized to make sure you've got full range of motion of your arm, that your shoulder is doing well. There's often a tendency after the surgery not to move your arm or shoulder that can lead to freezing of this, and we certainly don't want that to happen. Now, occasionally after the surgery, you need to be referred to a genetic counselor, because we now know that, as an example, your cancer is triple negative. And most cases of triple negative breast cancer now require a visit with a genetic counselor to be tested for the BRCA1 or 2 genes, or some other genes as well. So there's a lot you should be getting during that visit. If you've got drains in, how long are they going to be in? How much does the drainage decrease before the drains can be removed? If you're on preventative antibiotics with the drains in, how long do you need to be on them? That's sort of a list that I've been giving you now of the kinds of questions you should ask. Remember, surgery is only one part of your treatment. It's an important part. Make sure you have all the information from the results of that important surgery. Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.